Good morning. Myself, Dr. K. Anand, Senior Consultant Cardiologist, working here in Frontier Lifeline Hospital for the last 15 years. I have a good experience in simple and complex coronary interventions and pacemakers. Stress can be medically dangerous to the heart. Sleep is the most important thing in life. You need at least minimum 7 to 8 hours of sleep for a normal human being. Will help you to reduce the stress, your anxiety, whatever happening in your body, chemical reaction because of the stress will be reduced. So it's always better to take adequate rest so that you prevent this stress causing damage to the heart. When a person is on stress, there are two things happening. One can be an acute one that is happening suddenly. That will cause, for example, a rise in the blood pressure, heart rate to increase, and you will have some sort of heart rate disturbances. We call it as arrhythmias, and sometimes you have chest pain like an angina or a heart attack, and even a stroke. You may have a paralysis attack. These are all acute effects, like you have an immediate effect of the stress, too much of stress. And other type of stress is chronic stress, which is there for a long duration. This will happen for a long term effect of the chronic stress. What happens is that you start developing eating disturbances, and you start developing obesity, you start developing diabetes, start developing atherosclerosis, like deposition of cholesterol plaque in the blood vessels. Your blood vessels normally will be pliable, that is, it will contract and relax normally. But that endothelium, the inner lining of the vessel wall, gets into damage because of the stress. So the vessel becomes stiff and it will not dilate easily. So it can produce sometimes constriction of the heart, that is, it will produce constriction so that the patient develop a heart attack. If it attacks the vessel, it can have a heart attack. If it causes a constriction in the vessel to the brain, they may develop a stroke. So this is a chronic effect of stress. Usually, stress alone causing a problem happens when we are too young, actually. The old people normally have a risk factors of diabetes, hypertension, smoking habit, alcohol, lack of physical activity. These are the common risk factors, and they don't eat much fruits and vegetables. So these are the most common risk factors to develop a heart problem, along with the stress. But nowadays, younger generations, they find more amount of stress because of their work job, or they have a scheduled time which is random, like they have night duties, this thing, and they don't sleep properly in the night, and the morning they all sleep patterns all changes. So the amount of chemical reactions happening in our body, like hormonal reaction happening, can create this sort of stress induced problems. They think they are young, we can work very hard, but you must have your own limit, because our human body is limited actually. So you need to take adequate rest. Younger generation, they generally don't take care of themselves usually, because they think they are less prone to heart problems or a stroke. So medical professionals are having a very high risk first. Second, other people on an average, they live around 70 years on an average. So 70 to 75 years they live, general population. So what we do is for them is control their risk factors, like diabetes if it is there, hypertension, smoking habit, you have to stop, daily physical activity, walking for 30 minutes at least minimum a day. These are the things which they can do and try to avoid an event in their life.